Representative from Chelsea, Representative Sanderson.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, I rise to speak in opposition to the pending motion. It absolutely boggles my mind to think that after the experience Maine has had with expansion since 2001, there is anyone in this chamber who would be willing to walk further down the path of chronic DHHS shortfalls and underfunding of vital programs that already exist within the department today. Have we learned nothing while struggling to make state budget ends meet? Have we had any greater contributor to our chronic budget shortfalls than the Department of Health and Human Services? Who here has not seen the changes in percentage of funding over all state departments decline rapidly, while the DHHS share has grown at an equally rapid rate? With such a huge increase of departmental funding, approximately $1 billion per year more in state dollars than in 2001, you'd think we'd be on stable budgetary footing with current programming. But we're not. If it were earlier in the session and we hadn't worked through most of our bills, I would invite you to join us in HHS for a day and hear the wide range of advocates coming before our committee asking for additional funding to support current services, substance abuse services, children's services, targeted case management services in our schools, home-based services, community-based services, Head Start services, GA assistance services, homeless services, nursing home services, which we are underfunding by approximately $30 million per year, and dare I say it, yes, services for the individuals on our waiver wait lists. I'm sure you're tired of hearing myself and others continually harping about the list, but I feel we have to, so these individuals will not be left behind. Recently, every legislator in both bodies received an email from Cindy Levasseur. I have permission to use her story and her name in whenever I speak. Her son Michael, an autistic child, has aged out of the system and is now on the wait list. I called Cindy personally that very same evening that we all received her email. She told me she had a response from a member of this body who informed her that her son already had MaineCare and expansion wouldn't affect him. That leads me to believe that there are many in this chamber today who don't understand how our programs work. Yes, Michael has MaineCare that covers his basic medical services. What it doesn't cover are the services provided under Section 21 and 29 waivers, the home and community supports that are vital for waitlist individuals and their families. These supports are not reimbursed by traditional MaineCare. They are separate and very distinct programs. Expansion is traditional MaineCare, and not one penny of funding under expansion will or even can go toward these individuals to receive the vital services they need, for it is clearly defined in federal law that expansion includes parents and single non-disabled adults between the ages of 19 and 64. 19 and 64. This also excludes our elderly, and as we are in an aging state, the oldest state in the nation, that should also be of concern. So how does expansion affect the wait list? Medicaid expansion is not free. It is going to cost us millions of dollars above current budgetary needs. Millions. Under expansion, parents will not be covered at 100%. We've received the confirmation letter from CMS. We will only be reimbursed at the current rate of 61.5%. In the fiscal summary provided during our work session on this bill, we were given a projected cost of $1,618 per member per year for parents. According to the department, the actual cost of providing services is going to, in the fiscal year 2015, is $2,862 per person. That is over $1,200 more than what is projected. Extrapolate that out by the number of individuals, and you can easily see we will be millions more over the projected costs of parents. Pardon me. Because this is going to cost us millions more than current budgetary demands, even more once the 100% single adults start being reduced, if we should decide to go further with this, every dollar spent to support the thousands of individuals expected to enroll in MaineCare will be a dollar less we have to cover the neediest individuals who already qualify for waiver services. Ladies and gentlemen, this isn't a talking point just to fight against expansion. These are the facts. This is a fiscal reality. There is no denying that coverage for individuals who fall under the gap of the 100% of poverty level range needs to be addressed. However, make no mistake, this is not a debate about access. We all have access to medical care. This is a debate about payment structure and who's going to pay the bill. Hospitals and clinics, they all provide sliding scale fees for our lower income individuals. And we also have FQHCs that do the same. For anyone making under the $11,500 a year, an office visit is only $10. And they can also provide free care if the person really does not have the ability to pay. The rest, who are between 100% and 138%, are able to qualify for subsidies on the exchange. Substantial subsidies, which would bring their premiums from between $1.57 a month to $26.57 per month. The silver plans also provide a secondary subsidy for individuals to help with the copays and deductibles. Office visits, prescriptions, they have a $5 copay. There's a $200 deductible, a total out-of-year cost of $500. Preventative and wellness visits are free. There is no copay. These are affordable, and about 45,000 of the individuals who qualify for expansion qualify for these plans. There's also a report by the Congressional Research Service, which is prepared for members and committees of Congress, and it was dated July 31st, 2013. On page 6 of that report, 2 sentences under Medicare bullet state, if a person who applied for premium credits in an exchange is determined to be eligible for Medicaid, the exchange must have them enrolled in Medicaid. They have footnote number 29. Therefore, any state that expands Medicaid eligibility to include persons with income at or above 100% of federal poverty level will make such individuals ineligible for premium credits. Under the footnote 29, it references the fact that although nothing prohibits the ACA prohibits Medicaid eligible individual from enrolling in the exchange on his or her own, they will have to pay the full price all by themselves. Maine people up to 130% of poverty level who want to purchase their own insurance through the exchanges will no longer be able to. I believe we're almost up to 5,000 of these individuals who have already entered the exchanges. If we expand, they will be forced to come out of the private insurance market and onto MaineCare. I am not a fan of the ACA. I believe the sweeping and overreaching federal law handed down from the federal government has already and will continue to create more problems than it will ever solve within our healthcare payment system. However, with that said, unfortunately it's the law, and until something changes in D.C., we have to play the hand that we're dealt. The department estimates that in the next 3 years, expansion will cost $84 million above what we are already obligated to pay. The ORPR estimate is less than $1 million. That's a huge difference. Given the fact that the department numbers from 2012 were actual costs to provide services to members, the scale is heavily tipped in their favor for accuracy. However, just for argument's sake, let's split the difference. That still leaves almost $42 million in cost. $42 million state dollars that we do not have. At the beginning of this speech, I spoke of just a small list of the many current services that we are not adequately funding within the department. But the broad impact of 2001 and going forward, if we expand again, did and do not just affect the Department of Health and Human Services. DHHS is not an island unto itself. It touches all services, all functions. Revenue sharing, education, roads and bridges, public safety, our environmental and natural resources. Over the last 10 years, we've seen the growth in DHHS crashing over these other departments, eroding into their funding foundations like waves on a beach in a hurricane. If we expand, we invite a fiscal tsunami that could very well wash away our ability to adequately support all vital functions of state government. Is that what we really want? Thank you, Mr. Speaker.